Can I come in?
Yep.
Hi, my name is Claire. I'm going to be your student nurse today. Can you tell me your name and your date of birth, please?
Krista, 2/12/98.
All right, and do you know what day it is?
Yep, it's Sunday.
And where are you?
Edinburgh University.
Okay, perfect. Krista is a 20-year-old Caucasian female. She is dressed and groomed appropriately for the weather. Her posture is erect. She has nice pink undertones throughout her body, and she has a calm and pleasant affect. And she's in no signs of initial distress. All right, Krista, so what brought you in today?
My chest hurts a little bit.
Okay, and does anything cause the pain?
I don't think so.
Okay, and does anything help it?
Not that I know of.
Okay, and what type of pain is it? Like a stabbing, more like a pressure?
Like pressure.
Okay, and does it radiate, move anywhere throughout your body?
Not really.
Okay, and on a scale of 1 to 10, 10 being the worst pain you've ever felt, how would you rate it?
Like a 3.
Okay, and when did this start occurring?
Today.
Today? All right, so what I'd like to do is I'd like to do a head-to-toe assessment and just kind of check for any abnormalities and see why that's giving you chest pain. Is that okay?
Yep.
All right, we're going to start with some vitals.
Okay.
I'm just going to take your temperature. All right, 98.5, that's perfect. Next, I'm just going to take your pulse. Can I just see your wrist? Thank you. All right, and it's 80 beats per minute and regular, and I noticed as I was taking her pulse, she took 13 breaths per minute, which is perfect. Okay, next I'm just going to take your blood pressure, so I'm just going to need you to roll up your sleeves just a little bit for me. Okay, 120/60. And you said your pain was a 3 out of 10?
Yeah.
All right. Okay, just look straight ahead for me. Pupils are about 5 millimeters. All right, and then just look straight at my nose. All right, and follow my pen light. All right, and then follow it one more time. All right, Perla and EOMs are intact. All right, Krista, so what I'd like to do next is just start with like a head-to-toe assessment. Is that okay?
Yep.
All right, you can lay back down for me. All right, I noticed that the patient's trachea is midline. Her rate, pattern, and depth of breathing are all normal, and she has a symmetrical breathing pattern. Okay, first I'm just going to go down with the back of my hands to feel for temperature. Is that okay?
Mm-hmm.
Okay, and next I'm going to go down and feel for moisture. Okay, skin is dry, warm, pink, and intact. Next I'm just going to check for capillary refill. Alright, capillary refill is less than 3 seconds. Next I'm just going to check for some edema. Alright, 0 plus pitting edema. Alright, next, I'm just going to listen to your heart. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And this is where I would take the apical pulse for 1 minute. Alright, it's still 80 and regular. Next, I'm just going to ask you to turn your head to the left and to the right. Alright, negative JVD is noted. Next, I'm just going to feel for some pulses. So carotid, brachial, radial, femoral, popliteal, dorsalis pedis, and posterior tibialis. Alright, they're all 2+ bilaterally. So next, I'm just going to have a look at your stomach, if that's okay. Alright, the stomach is flat. I don't notice any scars or striae. No stomach breathing as well, so all good there. Next, I'm just going to take a listen. And bowel sounds are present in all 4 quadrants. And when was your last bowel movement?
Yesterday.
Alright, perfect. I'm just going to have you sit up for me, please. Next, I'm just going to listen to your lungs. So every time my stethoscope touch your back, take a nice deep breath through an open mouth for me, okay? Go ahead. Okay, and next I'm just going to have you lift your right arm up over your head, and we're going to do the same thing, okay?
Okay.
Go ahead. Okay, and bilateral breath sounds clear to auscultation. Alright, next I'm just going to have you squeeze my fingers, push me away, pull me towards you, and same thing with your feet, push away and pull towards you. Alright, and that's the end of the assessment. I'll go let the doctor know my findings.
Got it.